If you are a female in your 40s or 50s and you've been suffering from left shoulder pain that has not responded to normal conservative treatments, you might have a frozen shoulder and it might actually be related to your hormones. I am Dr. Brad Homan, board certified orthopedic surgeon, and I am a shoulder expert. So I'm going to start by saying that most shoulder pain that is not traumatic occurs because of inflammation around the rotator cuff, or rotator cuff tendonitis, or bursitis, which is also deep in the shoulder. And so the history there is, without a specific injury or trauma, maybe you slept on it wrong, maybe you kind of just moved in a certain way that was sort of unusual, that can flare up shoulder pain, and most of the time that's going to respond to normal conservative treatments, including activity modification, like a little bit of rest, avoiding the movements that hurt the shoulder. Ice, heat can be effective. Non-steroidal anti-inflammatory medications such as ibuprofen, Advil, Aleve, those are effective if you have no contraindications to taking those medications. And then a specific rotator cuff strengthening and stretching exercise program. So if you go through all of those things and you're not getting any better, it might actually be a condition we call frozen shoulder. So what is frozen shoulder? Frozen shoulder is kind of poorly understood. It happens without any specific etiology. There's no specific trauma or injury. It is basically an intense inflammatory response in your shoulder, which causes a lot of pain and discomfort. And then ultimately, as the process goes on, the shoulder starts to become stiff and then you lose mobility. And that's what we call a frozen shoulder. Now, the typical treatments for frozen shoulder would include what I'd mentioned before with the rest and the ice and the anti-inflammatories, stretching program, strengthening exercise program for the rotator cuff. But if those things are failing you, then it could potentially be because of your hormones. And the most likely culprit would be a decrease in the hormone estrogen. So estrogen, we know, is extremely important in lubricating joints. It also protects the tendons from getting tendonitis. It can protect your cartilage, and it also helps with bone mineral density. And so if your shoulder doesn't respond to normal conservative treatments, you might want to consider getting your hormones checked, because normalizing your hormone balance might actually fix the problem. So I will tell you that the left shoulder seems to be the most common culprit when it comes to this condition. However, the right shoulder can be a problem as well. So most of the time it's the left, but not always. So I hope you found this video helpful, and if you did, please like and subscribe to the channel. I've got a lot more content coming out, but I'm Dr. Brad Homan, board certified orthopedic surgeon, and as always, my message is take care of yourself and your body will take care of you.